So we're looking at Psoas diaphragm independence, the concept of that. And here's some technique ideas for addressing that. What we're looking to do is not establish but encourage a fascial plane between psoas and diaphragm. So a basic way is to work with the side of the hand, go right below the rib cage and right into where that fascial plane would be, where the difference between psoas and diaphragm is, where psoas stops and diaphragm begins. Either side, cross table's usually easier. Come in like so, and then pretty much get creative with any movement that you want to use. Greater trochanter is always a nice lever to use for a ton of purposes. And notice that we're also going to be affecting sacroiliac joint with moves like this. Remember, psoas and psoas and piriformis locate the sacrum. So coming into piriformis and doing this psoas diaphragm independence thing, it's a pretty cool thing. Blend it with the shoulder, especially coming in and getting a stretch to pec minor, while myofascial stretch piece on pec minor, and blend that with getting psoas diaphragm independence. Cross table, nice stretch. Blend it with neck. Opposite psoas. That over the top kind of stretch on the opposite psoas, a little pull on it, and then fascial plane between psoas and diaphragm. Remember, if it's very tender, if you come into psoas and it's extremely sensitive, you can always bring a leg up, make it all shorter and softer. Working within the client's comfort zone, certainly. Anything that causes pain, back off until it doesn't. You can challenge it, but don't get real, you don't want to confront. I don't confront psoas diaphragm. I kind of don't confront anything unless it's very tough scar tissue. But I ease my way in and get it to soften and come around. Movement going right in there. It'll start to get the idea of psoas and diaphragm getting the independence that they ideally would have. Pull on it, push back and forth, kind of a sawing action, but getting that pressure going right down in there into the space between psoas and diaphragm. Stretch right in that solar plexus area. Nice to get a nice stretch there and get into that connective tissue right in the front of the spine that's going to bleed into psoas and diaphragm. Not literally. If you get it to bleed literally, then your pressure's a little too heavy. At that point, I would back off. Do your knuckles. One side at a time, two sides at a time, whatever you feel is going to work. Always based, of course, on the client's body response. That's what guides, ideally, that's what guides your work. Using the proprioceptive concept, like in this case, a little jostle and paying attention to how the spine's moving, how the rib cage is moving, and I want to feel like they're opening up to what I'm doing, that I'm engaging the proprioceptors, and they're going to reflex to the muscles, and they're also going to set up an energy field, literally, an electromagnetic energy field that is conducive to what we're after, independence between psoas and diaphragm. All right, this is just some ideas. Primarily, mess with this technique, make up your own, keeping the concept in mind. You're looking to, because psoas and diaphragm can become from stress, worry, anxiety, from unresolved stress, worry, which becomes worry and anxiety, they start to have the same job, as opposed to have their anatomical and physiological ideal separate jobs. Diaphragm breathes, psoas flexes the hip, among other things, but primarily flexes the hip. You want to get those independent of each other, and you can give a client the feeling that they're getting independent of each other by establishing a fascial plane in between the two. All right, that's the idea for today. Peace. See ya.